All right, thank you. Looks like we've got another question from our online audience, and it goes like this. Can the panel comment on employer responsibilities regarding psychological health and safety in the workplace with respect to gender, and whether they think there's been an improvement with regards to destigmatizing mental health, mental illness, and bolstering employers' role in promoting mental wellness in workplaces? That's a bit of a loaded question. I guess we call that a triple barrel question. So I guess the first question would be specific to employer responsibilities regarding psychological health and safety in the workplace with respect to gender. And the second point would be whether or not there's been an improvement with regards to destigmatizing mental health and bolstering employees' role in promoting mental wellness in workplaces.
I can do part of that. There is a CSA standard. It's a national standard now for psychological health and safety in workplaces. I've read it. Our CCOHS is trying to implement and follow it. I don't think the word gender or sex appears in that in any way or form. It's just written to be, do it because it's the right thing to do. It's not, and it's flexible, but it never actually specifies the different sort of strata that the question asked. So in general, yes, there's more awareness about mental health and more, I think employers are taking action. There's a large thing from the Mental Health Commission, case studies coming up. We're participating in that as well. But again, gender specifically, I don't think is part of that. Unless, of course, it's relevant to why parts of your workplaces don't get along with another, then they'd have to address it, but it's nothing specific, as far as I know.
I do think, I've been out of the country for a little bit, so I don't know if I'm completely up to speed, but I know, in Ontario they introduced the mandatory legislation around bullying and harassment. Mm-hmm. Now, to the best of my knowledge, that hasn't been evaluated, or there basically is no ongoing monitoring surveillance of workplace hazards in Canada, period, let alone hazards that examining those by gender or age or anything else. I do think it would be interesting around the bullying and harassment legislation to try and examine how gender does play a role, even in just the reporting of those conditions. I imagine that there is probably stigma around men reporting harassment or bullying. I'm just guessing here, but I think so. I guess my answer to the question would be I'm not aware of anything that's going on, but I imagine that it's an important area where we need to understand a lot more.
My experience is that employers are attending to this issue more as it's become more public, and the Mental Health Commission's awareness building and voluntary standards and the Ontario legislation. There are many conferences and webinars and that sort of thing for employers to learn about their responsibilities, and specifically with respect to disability and accommodation, where you might have a circumstance where an employee is perhaps unfairly dismissed because of a mental health issue. When is it performance? When is it discrimination on the basis of health? And it's a very complex situation with case law being developed as we speak. But there are a wide variety of consultants and people who are engaged in the process. Again, I haven't seen a real gender analysis of any of that.
Another question from our online audience. To what extent and how challenging will it be to implement prevention programs for improving physical activity among young and middle-aged males and females? In other words, what sort of challenges should be kept in mind to implement an acceptable and effective exercise-based prevention program in terms of gender difference? And I'm curious to know where the workplace is implicated here, or where work more generally may be implicated here, except for the fact that physical activity is work. but maybe not.
Different context of the word work, right?
Exactly.
I'm not sure if this question is related to the fact that physical activity is really important in terms of a prevention of musculoskeletal disorders in the workplace, because certainly inactivity in younger people is much higher now than it has been in the past. And so I think we're going to see a cohort effect of there's an aging effect with musculoskeletal, because many of the injuries are wear and tear types of injuries, cumulative trauma injuries that occur over time. But the factors that go into that also include how strong those muscles and joints and physically fit people were in the first place. And we have a cohort of more inactive younger people than have ever been before. And there will be an impact in the workplace of more musculoskeletal injuries in younger people due to lack of physical fitness. I'm not sure about solving the problem of how to make the population more physically active and gender roles. I would say that I think there's less, on the positive side, I think there's some positive factors to work with in terms of, female athletics is much more high profile than it was, and to be a physically active and strong girl and all those types of things that weren't as valued by girls in the past, I think is more accepted. So maybe there's some positive things to build on, but also there's the video game generation that makes it much more difficult. So a lot of the physical activity is virtual, not real these days, and that is one of the increasing barriers I think we're going to have to deal with in terms of workplace musculoskeletal problems.
So I think I've got 2 points in relation to the question. One is, I think, in relation to what Joy was sort of saying, I think there is a study around non-specific low back pain which use vignettes to see what physicians would recommend. And males were far more likely to be recommended to a graded exercise program than women in terms of their recovery. And that was just based on vignettes. I think the understanding how the work environment impacts health behaviours is actually one of the questions that we want to answer, and we've got some funding from CIHR to answer this over the next couple of years. And this is related to the difference I spoke about before around job control, low job control and hypertension and diabetes outcomes. So one of the potential pathways about why men and women have different outcomes following low job control is because the behavioural responses to work stress differ between men and women. So health behavioural responses to work stress differ. And so we'll be looking at things such as physical activity, eating behaviour patterns, alcohol, smoking, and to see how they change in response to a work environment with low job control and whether that differs for men and women. So one of the interesting things about when we first released our study on low job control being associated with diabetes and how it was associated with women than men, the media automatically picked that up and said that's just because women eat more in response to having a high stress environment, and we didn't actually measure that in our study, but that was their conclusion based on the data, which there was none. So I think it is important to understand how the work environment influences health behaviour change and how and whether those changes have a biological basis or a social basis. So I mean, because of the dual roles that women have, there might be less time for them to engage in preventative activities such as high-intensity physical activity in response to a stressful day. So I think that's some of the stuff which we'll be trying to answer over the next couple of years, but I think it's certainly relevant.
I think just to add to that, if I can put a little bit more wood on the fire, is when we think about time constraints, particularly with, for example, caregiver employees or employees who have young children or numerous dependents, fast food is really attractive option. And we also know, certainly for vulnerable populations, that it's the less expensive food that's often the calorie-dense food. So, there's all sorts of, sex and gender implications and thinking about food accessibility, food cost, food preparation, knowledge about food. And so, it's quite an extensive topic.